Now, the numbers are staggering. While 65 million healthcare workers are serving our global front lines, there is an even greater untapped force standing right beside them, the patient themselves. For most, healthcare is a one-way street. Doctors give patients and patients receive, but a new movement is shifting, turning patients into the industry's most vital stakeholders. Now, to give us a sense of how patient advocacy and ground activations are bridging this gap in Malaysia, MANVIR Victor joins us. Thanks for joining us. MANVIR, even despite your busy schedule, I know you're in the car right now, but it's okay. We'll still go on with this interview. Now, at the most basic level, why is the industry looking toward patients to help solve healthcare challenges? Now, why are the stakeholders suddenly becoming the solution?
Thank you very much for having me, Melissa. Glad to be on Bernama once again. I think that you hit the nail on the head by asking why is it the industry is looking at it. Because globally, we've got about 8.2 billion people in the world currently, give or take a few more. But we've got, apparently, according to WHO stats, about 65 million healthcare professionals. And these are professionals who are not only doctors, but nurses, radiologists, pharmaceuticals, everything within that gamut. They've got about 65 million. Now, 65 million people taking care of everyone in the world because they need to take care of themselves as well, right? They do fall ill. I mean, situations like COVID happen. So all this works into it. So how do 65 million people treat and help 8.2 billion? It's an insurmountable task, right? And one which definitely needs help from other people. Now, how do we get the other people in? Well, the greatest stakeholder that any hospital, any healthcare system has is the patients that receive care. Now, these patients are already gone through the system, they know the system, and they have received care from the system. So these are the untapped people that can help the system itself. And where do we come in? We actually help them to communicate better to the ground. Now, I am a patient myself. I mean, you can just Google me and find out more. But I was on dialysis for 10 years before having a fantastic, life-changing kidney transplant in Hospital Kuala Lumpur in Malaysia. And as a result of that, I became one of the first WHO patient advocates in Malaysia. I lead a few organizations. I'm a part of so many other organizations that I'm privileged to be. And we are raising the awareness with the public on their rights, their availability, and also the chances that they have to help change lives for other people itself by just engaging with them and activating programs on the ground at a peer level. So it doesn't come across as anything else but a peer level, Melissa.
Now, you mentioned that you are a patient yourself and you managed to emerge, better after your dialysis treatment and so on and so forth. Now, in practical terms, MANVIR, how does patient advocacy actually help ease the burden on our doctors and nurses here in Malaysia?
Okay, in Malaysia, if I'm not mistaken, we have about 350 to 370,000 healthcare personnel. Everybody, again, are from private and public. They are taking care of approximately 34 million people. Now, the best part about healthcare is making sure that people continue to be healthy. Now, if they are not healthy, then they fall into this other category called sick care. They go to hospitals. Now, as we've heard from the Honorable Minister of Health, the Prime Minister, all these things that we've heard over the past couple of years, is there are more people going to hospital, which means that more people are getting ill. Now, how do we keep people healthy is listening to people who have been through the system, advising them, not only the doctors and nurses or radiologists, but their patients itself. And we are activated enough to be doing on-ground activation to be able to help these people and understand them better. Because we have the time, we can be trained, we can have access to better information, and all we want to do is allow other patients, the members of the public, to become a little healthier and understand their situation is not the end, but it's the start of being healthier. Myself, after my situation, I have become more aware of what it needs for me to become healthier and keep healthy so that my doctors are happier with me. I see my doctors less and they are less stressed as well.
Well, I love what you say because it starts from us, right? If you're healthy, we do not need to visit a doctor as often because they are really burdened as well with catering to too many patients right now. But, you know, in this day and age, there's so many activities like pickleball. But what stands out, why is a physical project like the Mount Kinabalu climb more effective than a standard awareness campaign? Now, tell us what is the specific trigger that ground activation flips in the public mind.
So I got to tell you, you know, when I had my transplant, I met another guy who had another transplant 2-3 weeks after me. And, you know, so, you know, when we used to go back for our regular checkups, we'll sit down and we'll chat with each other. And we dreamed of this time of climbing Kinabalu. So in 2022, we did our first climb. We had 3 transplant patients. It was Hanafi, Siba, and myself that climbed Kinabalu. With about 15 other people who just came in to support us, come out with the climb with us. In 2024, Siba climbed again. And this year, in 2026, in May, actually on the 6th to the 8th of May, we are climbing once again. And we are aiming to be on the Malaysian Book of Records because we have an entire group of 42 people. We've got about 10 doctors climbing with us. We have got members of the public, supporters coming out and climbing with us. A lot of members from the Rotary Club of Malawati, who is very much a support, you know, is our backbone of doing this. And we have got 17 patients, Melissa. 17 patients who have been through transplants. We've got a heart transplant patient. We have got lung transplant patient. We have got kidney transplant patients. Those are the most. And they're climbing with us, right? And we have 3 dialysis patients that are climbing with us. So this will be the first time ever in Malaysia that we're going to scale that mountain and we've got that many patients. It's a huge undertaking. The guys have been fantastic. They're constantly training to do this. But this is the thing, right? Us climbing that mountain and achieving that sets in space to everybody else. Transplant patients can do this. You know, patients on dialysis can do this. So now that's the human story that, you know, that's why the doctors are climbing with us, because the doctors are not climbing with us to take care of us. They're climbing to achieve it with us, you know, and we're doing this for the nation so that when we do this, and hopefully we get the Malaysian Book of Records, and then suddenly everyone is aware that patients are actively doing things to get themselves healthier. And, you know, as we go on this, I know we are constantly looking for partners in a journey to help us and take the patients up there as well.
Well, MANVIR is so interesting and inspiring as well as I look at the pictures being displayed on the screen. I think there's really a mental capacity for people to overcome their situation or challenges. And thanks for being leading this pack. Now I'd like to divert to, this isn't about patients working alone, as you mentioned. I would like to tap on how does Wira Transplant Malaysia collaborate with medical professionals to ensure that advocacy actually leads to better hospital outcomes?
Okay, the doctors and the nurses and the teams that we work with are inundated with the number of patients, right? Let's be honest about that. They are trying to do everything that they can to save those patients' lives. So we are looking from the outside in. How do we help? So this is where we collaborate with the doctors and I say, okay, if you need processes, if you need systems, if you need ideas, if you need project managers, those are the patients. We are not the sum of our illness. We are the sum of our experience that we have. Because a patient could be a doctor as well. It could be a lawyer. It could be an accountant. The patient could actually be an astronaut, for all you know. So those are the expertise that we bring into that, working with the doctors to raise them and help them. Because we know they need a lot of things. They need a lot of help. But when they're working in their hospitals or their clinics, they are covered. So we are looking from the outside in and trying to look at it and say, how do we raise awareness? How can we raise funds? And I'm glad to say that the Honorable Minister of Health, Dato Sri Zul, has been so supportive. He has come to our transplant walks. We've got a lot of organizations, hospitals that are looking at us and suddenly looking and saying, hey, these guys are actually making a difference. We have, for our transplant walks that we have every last Sunday of the month, we started in Kuala Lumpur. We have now branched out to Penang, Kuala Terengganu, Seremban, Kota Kinabalu, and another one here in Shah Alam. So we have got 6 transplant walks that happen every month. We are reaching a huge number of people. We are raising awareness on ground with doctors, with nurses, with the public. And this is where the idea is to bring the public into the sphere and understand that these patients are not helpless. They can be helpful.
Well, thank you, MANVIR. Truly inspirational, and thank you for leading the pack. And I wish you all the best. Thank you for weighing your insights on this crucial topic as well.
Thank you so much. If anybody wants, you have my Instagram handle. You can contact me, or even go to our viratransplant.org website. You can find out how you can come in and support us as we're doing this climb and taking 17 patients up. And we are hopeful that when we make that Malaysian Book of Records, Melissa, we'll be talking to you again.
Thank you, MANVIR, and all the best to you in May 2026 as well.